Question 1. Mr. Smith is a veterinary technician working in an emergency clinic. He receives a dog brought in by its owner who reports that the dog has been vomiting, lethargic, and has had diarrhea for the past 24 hours. Upon examination, Mr. Smith notices that the dog is dehydrated, has the high fever and a decreased heart rate. The dog's gums are pale, and he suspects the dog may have ingested something toxic. What should Mr. Smith? First, in this situation, A. Administer a dose of activated charcoal and prepare for a stomach lavage. B. Initiate an intravenous fluid therapy protocol to address dehydration. C. Administer anti-vomiting medication and monitor the dog's temperature. D. Take a sample for a blood culture and start antibiotic therapy. Answer B. Initiate an intravenous fluid therapy protocol to address dehydration. Explanation. In cases of suspected toxicity with dehydration, fluid therapy is a priority to stabilize the patient. The dog shows signs of dehydration, fever, and lethargy, indicating a need for fluids to address its immediate condition. Activated charcoal A might be administered later, but stabilization comes first. Administering anti-vomiting medication C would be counterproductive without addressing dehydration, and blood culture D is unnecessary before stabilizing the animal. Question 2. Which of the following best describes the role of the veterinary technician in managing anesthesia during a surgical procedure? A. The veterinary technician is solely responsible for performing the surgery while the veterinarian monitors anesthesia. B. The veterinary technician assists with preoperative care but does not participate in anesthesia monitoring. C. The veterinary technician is responsible for monitoring anesthesia and ensuring the animal's vitals are stable during surgery. D. The veterinary technician provides post-operative care but does not play anesthesia management. Answer C. The veterinary technician is responsible for monitoring anesthesia and ensuring the animal's vitals are stable during surgery. Explanation. Veterinary technicians are essential members of the surgical team and are responsible for monitoring anesthesia, maintaining the patient's airway, and observing vital signs such as heart rate, respiration, and blood pressure. They are trained to detect signs of anesthesia complications and to respond appropriately. Option A is incorrect because the veterinary technician does not perform surgeries. Option B is incorrect because the technician participates in anesthesia monitoring. Option D is incorrect because anesthesia management is critical during surgery, not just post-operatively. Question 3. A veterinary technician receives a blood sample from a cat suspected of being infected with a viral disease. The technician performs a complete blood count and notices that the cat's white blood cell count is significantly elevated and the red blood cell count is low. Which of the following conditions could these findings most likely indicate? A. Bacterial infection leading to an immune response with concurrent anemia. B. An allergic reaction resulting in marked increase in red blood cells. C. Viral infection leading to bone marrow suppression and secondary anemia. D. Nutritional deficiency causing both leukocytosis and anemia. Answer C. A viral infection leading to a bone marrow suppression and secondary anemia. Explanation. Elevated white blood cells, leukocytosis in response to infection, and a low red blood cell count, anemia, can be indicative of a viral infection, as viruses often suppress bone marrow function. The immune system's attempt to fight off the infection results in increased white blood cell production, while bone marrow suppression causes insufficient red blood production. Bacterial infection may cause elevated white blood cells, but it is less likely to cause significant anemia. An allergic reaction, B, typically causes eosinophilia but not anemia. Nutritional deficiencies, D, can cause anemia, but it would not explain the elevated white blood cell count. Question 4. Mrs. Roberts, a veterinary technician, is preparing a cat for a routine space surgery. The cat has a history of seizures which were controlled with medication up until recently. The cat is currently not on medication because the owner reported that the cat has been seizure-free for several months. However, Mrs. Roberts notices signs of increased anxiety and muscle tremors as the cat is being prepped for anesthesia. What should Mrs. Roberts do in this situation? A. Proceed with anesthesia as planned, ensuring the cat is properly restrained and monitored. B. Cancel the surgery and ask the owner to take the cat back home to avoid triggering a seizure. C. Inform the veterinarian about the cat's history and suggest a pre-anesthetic evaluation, including adjusting the anesthesia protocol to address the risk of seizures. D. Administer a sedative to calm the cat before continuing with the surgery preparations. Answer C. Inform the veterinarian about the cat's history and suggest a pre-anesthetic evaluation, including adjusting the anesthesia protocol to address the risk of seizures. Explanation. Given the cat's history of seizures and the signs of increased anxiety, it's important to adjust the anesthesia protocol to minimize the risk of triggering seizure. The veterinary technician should communicate with the veterinarian about the situation and pre-anesthetic evaluation. This may include considering medications that can prevent seizures or adjusting the anesthesia protocol. Option A is not appropriate due to the cat's medical history and current signs. Option B could be an option but does not consider the possibility of safely proceeding with surgery after careful evaluation. Option D could lead to an increased risk of seizures and should be avoided without proper veterinary guidance. Question 5. A veterinary technician is preparing to administer an injectable anesthetic to a dog. The technician notes that the dog has a history of severe reactions to certain anesthetics, including vomiting and respiratory depression. What is the most appropriate course of action to take before administering the anesthesia? A. Administer the anesthetic in the usual dose and monitor the dog closely during recovery. B. Inform the veterinarian about the dog's history and discuss the possibility of using an alternative anesthetic agent. C. Increase the dose of the anesthetic to ensure that the dog does not experience any discomfort during the procedure. D. Proceed with the anesthetic without informing the veterinarian, as the dog may simply be anxious. Answer. B. Inform the veterinarian about the dog's history and discuss the possibility of using an alternative anesthetic agent. Explanation. The dog has a history of severe reactions to anesthetics, so it is crucial to notify the veterinarian to review the dog's medical history and determine if safer anesthetic agents should be used. The veterinarian may opt for an alternative agent that poses less risk based on the dog's history. Option A is incorrect because administering the anesthetic without considering the dog's history could lead to serious complications. Option C is not appropriate, as increasing the dose could exacerbate the dog's reaction. Option D is also incorrect because the dog's previous history of reactions indicates that anxiety is unlikely to be the sole cause of the symptoms. Question 6. A veterinarian has prescribed a broad-spectrum antibiotic for a cat diagnosed with a bacterial infection. The veterinary technician is responsible for educating the owner about proper administration of the antibiotic. Which of the following should the veterinary technician emphasize to the owner regarding the medication? A. The antibiotic should be given with food to reduce the chance of gastrointestinal upset, and the full course of treatment must be completed even if the cat appears to improve. B. The antibiotic should only be given when the cat shows signs of illness and should be stopped once the cat feels better. C. The antibiotic should be administered as prescribed but should not be given in conjunction with any other medications, including over-the-counter supplements. The antibiotic should be given on an empty stomach to ensure better absorption, but the owner should stop the medication if the cat shows any side effects. Answer A. The antibiotic should be given with food to reduce the chance of gastrointestinal upset, and the full course of treatment must be completed even if the cat appears to improve. Explanation. It's important to emphasize that the full course of antibiotics should be completed to ensure the bacterial infection is fully treated and to avoid the development of antibiotic resistance. Giving the medication with food helps prevent gastrointestinal upset. Option B is incorrect because stopping the antibiotic prematurely could result in an incomplete treatment, leading to relapse or resistance. Option C is incorrect because the veterinarian may have prescribed the antibiotic along with other medications or supplements. Option D is wrong because antibiotics should not be stopped due to side effects without consulting the veterinarian. Question 7. A veterinary technician is performing a complete physical examination on a dog and notes that the dog has abnormal heart rhythms, a heart murmur, and labored breathing. The technician suspects that the dog may have a heart condition. Which of the following is the most appropriate next step? A. Reassure the owner that the dog's symptoms are likely due to anxiety and recommend calming agent. B. Recommend that the dog be immediately referred for cardiac evaluation, including an echocardiogram, to determine the underlying cause. C. Continue to monitor the dog's symptoms and recommend follow-up visit in few days. D. Suggest administering diuretic to alleviate the labored breathing and improve heart function. Answer. B. Recommend that the dog be immediately referred for cardiac evaluation, including an echocardiogram, to determine the underlying cause. Explanation. A Abnormal heart rhythms, heart murmurs, and labored breathing are significant signs that warrant further investigation. A referral for a thorough cardiac evaluation, including an echocardiogram and ECG, will help determine the specific heart condition. Option A is incorrect because the symptoms could indicate a serious cardiac issue, not anxiety. Option C is not advisable, as a delay in diagnosis could lead to the dog's condition worsening. Option D is inappropriate because diuretics are used to manage heart failure symptoms but should only be prescribed after proper diagnosis. Question 8. A client brings their pet rabbit into the clinic for an examination, complaining that the rabbit has been lethargic and refusing to eat for the past 2 days. Upon examination, the veterinary technician notes that the rabbit's gastrointestinal system is not functioning properly and the rabbit has bloated abdomen. The technician suspects gastrointestinal stasis, a common condition in rabbits. What is the best course of action for the technician to take? Administer a broad-spectrum antibiotic and recommend a change in diet to high-fiber foods. B. Begin fluid therapy and provide supportive care to address dehydration and stimulate gastrointestinal motility. C. Recommend a surgical consultation immediately, as gastrointestinal stasis typically requires invasive treatment. D. Offer a laxative and suggest that the owner continue monitoring the rabbit's condition for the next few days. Answer: B. Begin fluid therapy and provide supportive care to address dehydration and stimulate gastrointestinal motility. Explanation: gastrointestinal stasis in rabbits requires supportive care, including fluid therapy to rehydrate the rabbit and medications to stimulate gut motility. This condition is often managed conservatively without the need for surgery, making option B the most appropriate. Option A is incorrect because antibiotics are not effective for gastrointestinal stasis unless there is a secondary infection, and dietary changes alone will not resolve the issue. Option C is incorrect because surgery is not typically needed for gastrointestinal stasis unless there is a complication like obstruction. Option D is incorrect because a laxative could cause more harm if the rabbit has bloating or gas. Question 9. A veterinary technician is reviewing a dog's medical history and notices that the dog is overdue for vaccinations. The dog's owner is unsure about the vaccination schedule and asks for advice on whether it is too late to administer the vaccine. What should the veterinary technician advise? A. The dog should receive the vaccine immediately, as long as the owner agrees. B. The dog should undergo titer tests to check for immunity levels before determining if the vaccine is necessary. C. The vaccine should be administered only if the dog shows signs of illness, as this is the most effective time to vaccinate. D. The technician should inform the owner that vaccination is unnecessary and no further action is needed. Answer: B. The dog should undergo a titer test to check for immunity levels before determining if the vaccine is necessary. Explanation: a titer test measures the dog's existing immunity to certain diseases. If the test shows that the dog has sufficient immunity, vaccination may not be needed. However, if the immunity levels are low, the veterinarian can proceed with vaccination. Option A may not be appropriate without knowing the dog's immunity status. Option C is incorrect because vaccines are preventive, not reactive to illness, and waiting for signs of illness to vaccinate is unsafe. Option D is incorrect because vaccination may still be necessary for some diseases and the technician should assess the dog's immunization status. Question 10. A veterinary technician is assisting with a surgical procedure involving a young dog that has been diagnosed with hip dysplasia. The veterinarian plans to perform a femoral head ostectomy to treat the condition. What should the veterinary technician be most focused on during the post-operative care phase for this dog? A. Providing pain management, monitoring for signs of infection, and beginning physical rehabilitation early to ensure proper recovery. B. Administering broad-spectrum antibiotics and ensuring that the dog has well rested during recovery. C. Encouraging the dog to walk as soon as possible to prevent any stiffness in the joint. D. Focusing primarily on wound care and avoiding any movement of the hip joint during the recovery period. Answer A. Providing pain management, monitoring for signs of infection, and beginning physical rehabilitation early to ensure proper recovery. Explanation: post-operative care for toe surgery involves managing pain effectively, monitoring for infection, and starting rehabilitation early to improve mobility and prevent joint stiffness. This is crucial for optimal recovery. Option B is too general and lacks focus on the specific needs of post-surgical rehabilitation. Option C could lead to joint complications if the dog is encouraged to walk too soon. Option D is also incorrect because while wound care is important, Some movement and rehabilitation are necessary for recovery after phytose surgery. Question 11. A veterinary technician is preparing a dog for surgery and notices that the dog has a history of severe allergic reactions to certain medications, including antibiotics and anesthetics. The technician must administer a pre-anesthetic injection to the dog. What should the technician do before proceeding? A. Administer the pre-anesthetic injection as usual, but monitor the dog for signs of a reaction. B. Consult with the veterinarian about the dog's history of allergic reactions and determine the safest course of action, including using alternative medications if necessary. C. Avoid administering any medications and recommend rescheduling the surgery. D. Give the dog mild sedative before administering the pre-anesthetic injection to reduce anxiety. Answer. B. Consult with the veterinarian about the dog's history of allergic reactions and determine the safest course of action, including using alternative medications if necessary. Explanation. Given the dog's history of severe allergic reactions, it is critical to communicate with the veterinarian to determine an appropriate course of action. The veterinarian may recommend alternative medications or pre-medications to ensure the dog's safety during surgery. Option A is not recommended due to the risk of an allergic reaction. Option C could unnecessarily delay the procedure without trying to manage the risk. Option D is incorrect, as administering sedative may not address the core issue of the allergic reactions. Question 12. A veterinarian has prescribed a new pain management protocol for a dog following orthopedic surgery. The dog is to receive a combination of non-steroidal anti-inflammatory drugs, NSAIDs, and an opioid analgesic. The veterinary technician notices that the dog is displaying signs of gastrointestinal distress, such as vomiting and diarrhea, within a few days after starting the medications. What is the most appropriate action? A. Continue with the current pain management protocol and monitor the dog closely. B. Discontinue the NSAID and consult with the veterinarian to assess the need for an alternative medication or adjustment to the current protocol. C. Switch the dog to a different opioid analgesic, as the current one may be causing the symptoms. D. Administer a gastrointestinal medication to counteract the distress while maintaining the current pain management regimen. Answer. B. Discontinue the NSAID and consult with the veterinarian to assess the need for an alternative medication or adjustment to the current protocol. Explanation. NSAIDs can cause gastrointestinal distress in some animals. The most appropriate step is to discontinue the NSAID and consult with a veterinarian for alternative pain management options or adjustments to the regimen. Option A is not advisable, as continued use of the NSAID could worsen the gastrointestinal distress. Option C is not addressing the primary issue, which is the NSAID. Option D is not an optimal approach, since addressing the underlying cause. NSAID is more effective than just managing the symptoms. Question 13. A veterinary technician is assisting with the spaying of a female dog. The veterinarian has noted that the dog is significantly overweight. During surgery, the technician observes that the dog's tissue is more fatty than expected, which may pose challenges during the procedure. What should the technician be most focused on during the surgery? A. Minimizing the anesthesia dosage to prevent complications related to obesity. B. Ensuring that the surgical site is properly exposed and that any fatty tissue is carefully handled to prevent complications. C. Giving the dog additional sedation to ensure it remains calm throughout the procedure. D. Administering a higher dose of antibiotics to reduce the risk of infection due to the fatty tissue. Answer. B. Ensuring that the surgical site is properly exposed and that any fatty tissue is carefully handled to prevent complications. Explanation. Obesity can complicate surgeries by making it harder to properly expose and access internal organs. The veterinary technician should focus on ensuring the surgical site is appropriately handled and that fatty tissue is carefully managed to prevent complications. Option A is incorrect, as the anesthesia dosage is typically adjusted based on the patient's body weight and health status, not just obesity. Option C is unnecessary, as excessive sedation may complicate the procedure. Option D is not warranted, since antibiotics should be prescribed based on the surgical site and risk, not solely on the patient's body composition. Question 14. A cat with a suspected upper respiratory infection (URI) is brought into the clinic for evaluation. The veterinarian suspects that the infection is viral and wants to rule out any secondary bacterial infections. What is the most appropriate action for the veterinary technician to take? Administer an antibiotic to treat any potential bacterial infection while waiting for further tests. B. Perform diagnostic tests such as a nasal swab PCR test to confirm whether the infection is viral or bacterial before administering any antibiotics. C. Recommend that the cat be sent home with supportive care and only return if symptoms worsen. D. Administer a broad-spectrum antiviral medication to treat the immediate. Answer B. Perform diagnostic tests such as a nasal swab PCR test to confirm whether the infection is viral or bacterial before administering any antibiotics. Explanation: it is important to differentiate between viral and bacterial infections before administering treatment. Performing diagnostic tests will help guide treatment and prevent unnecessary antibiotic use. Option A is not appropriate because antibiotics should not be used unless a bacterial infection is confirmed. Option C may delay necessary treatment, especially if a secondary bacterial infection is present. Option D is not correct because antiviral medications are not typically used for most URIs in cats unless a specific viral pathogen is identified. Question 15. A veterinary technician is preparing to assist with a dog's dental cleaning and prophylaxis. The dog has known history of dental issues, including severe plaque buildup and gingivitis. The veterinarian recommends performing full-mouth radiographs to assess for any underlying dental issues that may not be visible on the surface. What should the technician do in preparation for the procedure? A. Ensure that the dog is well sedated to allow for thorough cleaning and radiograph. B. Administer local anesthetic to numb the dog's mouth prior to the cleaning. C. Prepare for full mouth extraction procedure in case severe dental disease is found. D. Begin cleaning the teeth immediately after sedation without taking radiographs. Answer A. Ensure that the dog is well sedated to allow for a thorough cleaning and radiographs. Explanation: full-mouth radiographs are essential for assessing underlying dental issues that cannot be seen by the naked eye. Sedation is necessary for the procedure as it allows for proper radiographic positioning and thorough cleaning. Option B is incorrect because the sedation should be sufficient for both the cleaning and radiographs, and a local anesthetic is not typically necessary. Option C is premature as the technician should not assume extractions will be necessary without a full evaluation. Option D is incorrect because radiographs should be taken before any cleaning to assess the full extent of dental issues. Question 16. A pet rabbit is brought into the clinic after its owner notices that the rabbit has not been eating or drinking for the past 24 hours. The technician performs a physical exam and notes signs of dehydration and a bloated abdomen. The veterinarian suspects gastrointestinal stasis. What should the veterinary technician focus on immediately? A. Administer fluids and initiate supportive care to rehydrate the rabbit while monitoring its gastrointestinal function. B. Recommend a dietary change immediately to increase the rabbit's fiber intake and encourage eating. C. Perform abdominal surgery to remove any obstructions that may be causing the bloating. D. Administer broad-spectrum antibiotic to prevent secondary infections and support recovery. Answer A. Administer fluids and initiate supportive care to rehydrate the rabbit while monitoring its gastrointestinal function. Explanation: gastrointestinal stasis is a common condition in rabbits that requires supportive care, including fluid therapy to rehydrate and stimulate gastrointestinal motility. Monitoring and supportive care are critical before any invasive procedures are considered. Option B is incorrect as dietary changes alone will not address the immediate dehydration and motility issues. Option C is premature and invasive, that surgery should only be considered if other treatments fail or if there is a clear obstruction. Option D is not necessary unless there is evidence of infection. Question 17. A veterinary technician is assisting with a routine wellness checkup for a dog that has recently undergone treatment for a chronic skin condition. The dog has been on long-term corticosteroid therapy and is now showing signs of lethargy and increased thirst. The technician should be concerned about which of the following potential side effects of corticosteroid use. A. Hyperglycemia and dehydration. B. Hypertension and electrolyte imbalances. C. Hypothyroidism and weight loss. D. Hyperkalemia and muscle weakness. Answer A. Hyperglycemia and dehydration. Explanation: long-term corticosteroid use can lead to side effects such as hyperglycemia, increased blood sugar, and dehydration due to the drug's effects on the body's water retention and insulin production. These symptoms warrant further investigation and possible adjustments to the dog's treatment plan. Option B is not typically associated with corticosteroids in the same manner as hypoglycemia and dehydration. Option C and D are not common side effects of corticosteroid therapy. Question 18. A veterinary technician is preparing to administer an intramuscular injection of a vaccine to a young cat. The technician notes that the cat is very anxious and has a history of aggressive behavior during past visits. What should the technician do to ensure a successful injection? A. Restrain the cat firmly and quickly administer the injection to minimize the risk of injury to the technician. B. Administer a mild sedative before the injection to reduce anxiety and prevent aggression. C. Wait until the cat calms down before administering the vaccine, even if it takes longer than expected. D. Ask the owner to restrain the cat to ensure the technician can focus solely on administering the injection. Answer. B. Administer mild sedative before the injection to reduce anxiety and prevent aggression. Explanation. Given the cat's history of anxiety and aggression, it is important to use mild sedative to reduce stress and prevent harm to both the technician and the cat. Option A may lead to injury due to the cat's aggressive behavior. Option C may not be effective enough in preventing injury, especially if the cat remains highly agitated. Option D is not ideal because the technician should be in control of the injection process to ensure safety and accuracy. Question 19. A veterinary technician is reviewing the medical records of a dog that has recently been diagnosed with heartworm disease. The veterinarian has prescribed a treatment regimen that includes the administration of melarsoline injections. What should the veterinary technician emphasize to the owner during the treatment process? A. The dog should remain on strict bed rest for several weeks following the injections to avoid complications. B. The dog should receive additional vaccinations during treatment to boost the immune system. C. The dog should be allowed to exercise and continue normal activity during treatment to prevent stress. D. The dog will be fully cured after the first injection and will not require further treatment. Answer A. The dog should remain on strict bed rest for several weeks following the injections to avoid complications. Explanation. Following melarsoline injections for heartworm disease treatment, it is crucial to restrict the dog's activity to prevent complications such as embolism caused by dying worms. Bed rest helps reduce the risk of these serious side effects. Option B is incorrect because vaccinations are typically avoided during heartworm treatment to reduce the stress on the dog's system. Option C is incorrect because exercise can exacerbate complications. Option D is incorrect because heartworm treatment is typically a multi-step process requiring follow-up injections and care. Question 20. A veterinary technician is assisting with the monitoring of a cat during anesthesia for a routine dental cleaning. The cat begins to show signs of a drop in heart rate and blood pressure during the procedure. What should the technician do first? A. Administer a sedative to stabilize the heart rate. B. Increase the anesthetic depth to ensure the cat is adequately anesthetized. C. Notify the veterinarian and begin monitoring the cat's vital signs more frequently while adjusting the anesthesia as directed. D. Terminate the procedure immediately and allow the cat to recover. Answer. C. Notify the veterinarian and begin monitoring the cat's vital signs more frequently while adjusting the anesthesia as directed. Explanation. Drop in heart rate and blood pressure could indicate an adverse reaction to anesthesia or other underlying issues. The technician should notify the veterinarian immediately and begin more frequent monitoring to assess the cat's condition. Adjustments to the anesthesia protocol can be made under the veterinary direction. Option A is inappropriate without understanding the cause of the changes. Option B is incorrect because increasing the anesthesia depth could worsen the condition if the problem is not related to anesthesia depth. Option D is premature as the technician can address the issue with appropriate monitoring and adjustments. Question 21. A veterinary technician is assisting in a routine space surgery on a cat. During the procedure, the technician notices the presence of an enlarged and hardened lymph node near the surgical site. The veterinarian suspects the possibility of a localized infection or malignancy. What should the technician do next? A. Continue with the surgery, ignoring the lymph node, and monitor the cat after the procedure. B. Record the findings and inform the veterinarian immediately, ensuring the lymph node is biopsied or assessed for further investigation. C. Administer a strong antibiotic to prevent any potential infection from spreading. D. Postpone the surgery to allow time for further diagnostic testing. Answer. B. Record the findings and inform the veterinarian immediately, ensuring the lymph node is biopsied or assessed for further investigation. Explanation: enlarged and hardened lymph nodes could indicate infection or cancer. It is crucial to inform the veterinarian, who may decide to perform further diagnostics like biopsy or aspiration to identify the cause. Option A could overlook an important clinical finding. Option C may not be appropriate until a proper diagnosis is made. Option D might unnecessarily delay treatment unless the veterinarian feels further diagnostics are required before proceeding. Question 22. A pet rabbit is brought into the clinic showing signs of lethargy and poor appetite. After performing a physical exam, the veterinarian diagnoses gastrointestinal stasis, which is common in rabbits. The technician is instructed to administer fluids and medications to assist in recovery. What is the most important aspect of nursing care for this rabbit? A. Provide a high-fiber diet immediately to stimulate gastrointestinal motility. B. Monitor hydration status and support fluid therapy to address dehydration. C. Administer a broad-spectrum antibiotic to prevent secondary infections. D. Allow the rabbit to rest and refrain from giving any food or water until further notice. Answer: B. Monitor hydration status and support fluid therapy to address dehydration. Explanation: gastrointestinal stasis can lead to dehydration, so maintaining hydration through fluid therapy is a priority in treatment. Monitoring hydration status ensures the rabbit's condition is properly managed. Option A is important but should be considered after addressing hydration. Option C may not be necessary unless there are signs of infection. Option D is incorrect as the rabbit needs fluids and proper nutrition to aid in recovery. Question 23. A client brings in their elderly dog for a wellness check. The dog is showing signs of increased thirst, frequent urination, and weight loss despite a normal appetite. The veterinarian suspects diabetes mellitus. The veterinary technician is tasked with preparing for a blood glucose test. What should the technician be most mindful of before drawing blood? A. Ensure the dog has fasted for 12 hours to obtain accurate blood glucose readings. B. Collect the blood sample from a vein in the dog's leg and prepare for immediate insulin administration. C. Make sure the dog is well hydrated and provide water before collecting the sample to prevent hemoconcentration. D. Avoid drawing blood if the dog is stressed, as this could affect the blood glucose results. Answer: C. Make sure the dog is well hydrated and provide water before collecting the sample to prevent hemoconcentration. Explanation: hydration is important for accurate blood glucose levels, as dehydration can cause hemoconcentration, skewing results. Option A is not necessary, as fasting may not be required for a blood glucose test in this case. Option B is not appropriate at this point, as insulin administration would only occur after confirming the diagnosis. Option D is incorrect. While stress can affect blood glucose, it is not always a reason to delay testing. Question 24. A young puppy is brought in for its first vaccinations. The veterinarian instructs the veterinary technician to administer the core vaccines, distemper parvovirus and adenovirus. However, the puppy is very nervous and anxious. What is the best approach to administering the vaccines to ensure a smooth and safe experience? A. Immediately administer all vaccines without delay to minimize the puppy's anxiety. B. Calmly restrain the puppy, provide gentle handling, and administer the vaccines one at a time to reduce stress. C. Postpone vaccination and recommend that the owner bring the puppy back when it's less anxious. D. Administer mild sedative to calm the puppy before vaccination. Answer: B. Calmly restrain the puppy, provide gentle handling, and administer the vaccines one at a time to reduce stress. Explanation: gentle handling and minimizing stress are essential for both the safety and well-being of the puppy. Administering the vaccines one at a time will allow the technician to focus on each one individually and reduce anxiety. Option A could increase stress and anxiety. Option C would delay necessary vaccinations. Option D might be unnecessary unless advised by the veterinarian, as the puppy should be able to handle the vaccines with calm handling. Question 25. A cat with a history of chronic kidney disease, CKD, has been brought in for a checkup. The veterinarian wants to assess the cat's kidney function further and orders a series of tests, including blood panel, urinalysis, and blood pressure measurement. The veterinary technician is tasked with collecting urine sample. Which of the following is the most appropriate method for obtaining urine sample from cat? A. Collect the urine from the cat's litter box after it has urinated. B. Used sterile needle and syringe to perform cystocentesis to collect clean sample. C. Ask the owner to bring in sample of the cat's urine from home. D. Place the cat in cage with clean litter box and wait for it to urinate naturally. Answer: B. Use a sterile needle and syringe to perform a cystocentesis to collect a clean sample. Explanation: cystocentesis is the most reliable method for obtaining a clean, uncontaminated urine sample in cats, especially when assessing kidney function. It allows for precise analysis without contamination from the bladder, urethra, or litter. Option A is not ideal because urine collected from a litter box could be contaminated. Option C could lead to contamination as the sample may not be properly preserved. Option D is also not ideal as waiting for natural urination could be time-consuming and less reliable. Question 26. A dog has been brought in with a suspected case of Lyme disease after being exposed to ticks in an area where Lyme disease is prevalent. The veterinary technician is tasked with educating the owner about prevention and treatment. Which of the following should the technician emphasize to the owner regarding the prevention of Lyme disease? A. Regular tick prevention treatments and routine vaccinations for Lyme disease. B. Annual Lyme disease vaccinations are sufficient for all dogs, regardless of exposure to ticks. C. Ticks can only transmit Lyme disease during the summer months, so prevention should only be needed during that time. D. It's safe to rely solely on flea control products for preventing tick exposure. Answer: A. Regular tick prevention treatments and routine vaccinations for Lyme disease. Explanation: the best prevention for Lyme disease includes regular tick prevention treatments and vaccinations, if recommended by the veterinarian, especially in areas where ticks are prevalent. Option B is partially correct, but Lyme disease prevention also involves tick control, not just vaccinations. Option C is incorrect because ticks can be present year-round, not just during the summer months. Option D is inadequate as flea control products typically do not provide effective protection against ticks. Question 27. A dog is presented with a suspected allergic reaction to a new flea medication. The technician notices swelling, hives, and difficulty breathing. The veterinarian quickly diagnoses an anaphylactic reaction and instructs the technician to administer an epinephrine injection. What is the most important consideration when administering epinephrine to this dog? A. The epinephrine should be administered intramuscularly to rapidly reverse the symptoms. B. Epinephrine should only be administered intravenously due to the severe nature of the reaction. C. The epinephrine should be given as a subcutaneous injection for the best effect. D. Wait for the symptoms to worsen before administering epinephrine to ensure effectiveness. Answer: A. The epinephrine should be administered intramuscularly to rapidly reverse the symptoms. Explanation: epinephrine is typically administered intramuscularly in cases of anaphylaxis to quickly reverse symptoms like swelling and difficulty breathing. Option B is incorrect as intravenous administration is not typically required for epinephrine unless specifically directed. Option C is less effective than intramuscular injection in this emergency scenario. Option D is not advisable. Immediate intervention with epinephrine is critical in anaphylactic reactions. Question 28. A guinea pig has been brought in with a suspected urinary tract infection (UT). The veterinarian orders a urinalysis to confirm the diagnosis, and the veterinary technician is tasked with collecting the sample. The technician should be cautious about which of the following during the collection process. A. Ensuring that the guinea pig's urine is collected in clean container to avoid contamination. B. Applying pressure to the bladder to induce urination in the guinea pig. C. Using sterile technique to collect the urine sample via cystocentesis or manual expression. D. Waiting for the guinea pig to urinate naturally without any additional steps. Answer: C. Using a sterile technique to collect the urine sample via cystocentesis or manual expression. Explanation: for accurate results, especially in cases of suspected UT, the technician should use a sterile technique to collect the urine sample either through cystocentesis or gentle manual expression. Option A is important, but sterile technique is paramount for accurate results. Option B could cause injury to the guinea pig if done incorrectly. Option D may result in a contaminated sample, leading to inaccurate diagnostic results. Question 29. A cat has been brought in after being hit by a car. The veterinarian suspects multiple fractures and internal injuries, and the veterinary technician is tasked with stabilizing the cat's condition for surgery. The technician should prioritize which of the following actions. A. Administer fluids and oxygen to stabilize the cat's blood pressure and oxygen levels. B. Perform complete blood count CBC in urinalysis before proceeding with surgery. C. Begin preparing for surgery immediately without stabilization, as time is of the essence. D. Administer pain medication and allow the cat to rest before surgery. Answer A. Administer fluids and oxygen to stabilize the cat's blood pressure and oxygen levels. Explanation. In trauma cases like this, it is critical to stabilize the animal first by ensuring adequate fluid support and oxygenation. This helps address shock, maintain blood pressure, and ensure proper oxygen delivery to vital organs before moving on to surgery. Option B is important, but stabilizing the cat is the priority before diagnostic tests are performed. Option C skips necessary stabilization steps, which could endanger the cat during surgery. Option D could delay essential stabilization and increase the risk of complications. Question 30. A dog with chronic arthritis has been prescribed non-steroidal anti-inflammatory drugs, NSAIDs, to manage pain and inflammation. The veterinarian also instructs the veterinary technician to monitor the dog's liver and kidney function. What is the technician's role in monitoring the potential side effects of the prescribed NSAID? A. Monitor the dog's temperature and pulse rate every 12 hours for the duration of the treatment. B. Perform blood work to monitor liver and kidney function, especially during long-term NSAID therapy. C. Instruct the owner to discontinue the NSAID immediately if the dog shows signs of vomiting or diarrhea. D. Administer additional medications to protect the liver and kidneys while the dog is on NSAIDs. Answer. B. Perform blood work to monitor liver and kidney function, especially during long-term NSAID therapy. Explanation. NSAIDs can have potential side effects on the liver and kidneys, especially with prolonged use. It is important to monitor liver and kidney function through regular blood work to detect any early signs of toxicity. Option A is not a comprehensive monitoring plan, as temperature and pulse rate alone won't give insight into liver or kidney function. Option C is premature, as minor gastrointestinal upset does not necessarily mean the NSAID must be discontinued. If the veterinarian would evaluate the symptoms. Option D may be appropriate in some cases, but regular monitoring is the first step in ensuring safe NSAID use.